Thank you so much, Carly. And joining us right now, representing the great state of Louisiana, Governor John Bel Edwards. Governor, thank you so much for your time today.
Harrison, it's good to be with you. Thank you.
My pleasure. So one whole year since Louisiana reported its first known COVID-19 case. Amazing to see how far we've come. And so on this anniversary, where does the state stand in this fight?
Well, certainly we're doing better than we were at the start of the year when we were at the peak thus far in the pandemic in terms of positivity of tests, case growth, hospitalizations, deaths, all of that. We've done much better, and I will tell you, I'm gratified by that. A lot of people are doing good work when it comes to slowing the transmission by masking and distancing. And we have about a third of the positivity that we had then. We're a little less than 5% today. We have a little over 500 people in the hospital today, which is less than a third of what was there at the start of the year. And deaths are still stubbornly high, 2021 every day, which is obviously something we're working very hard to try to get that to zero. But we're doing better. The challenge we have is that we've got these variants, especially the UK variant, we know to be all over Louisiana, and it's more easily transmitted, and it's a little bit more virulent, meaning that if you get COVID-19 from this variant, you're likely to have a more serious case and end up in the hospital and so forth. So we're really racing to get as many people vaccinated as possible while we're trying to slow the transmission down, especially as it relates to the variant, which is why we have the mask mandate still in place. But clearly we're doing better than we were several weeks ago, and I'm very thankful for that.
And of course, by no means is this over. And we often hear that challenges bring in the best of people, bring people together. And of course, in many ways, as you've seen, it certainly has done that. But how has COVID-19 also exposed the disparities, inequities even, between people in our society?
Yeah, well, Harrison, as you know, we were, I think, the first state in the nation to release a report last April that detailed the disparate impact COVID-19 was having in Louisiana with respect to race. So, for example, at that time, almost 70% of the deaths were among African Americans in Louisiana, even though they comprise only 33% of the state's population. Now, that number, that percentage, I should say, has come down over time, but African Americans are still overrepresented. And so what we know is that the more health disparities there are, more prevalent comorbid health conditions, for example, in a certain population, that predisposes that population to be more vulnerable to the disease and to have poorer outcomes, more likely end up in the hospital or to die. And so this pandemic has shown a spotlight on that. And obviously we created the Health Equity Task Force to help deal with that. They have made tremendous strides forward, helping us deal with the pandemic and then beyond the pandemic as well, because we have a lot of work to do in Louisiana. But I will tell you that was a very sobering point in the response to the pandemic when we realized the disparate impact. And look, we're closing in on 10,000 deaths, and they're white, black, Hispanics, and so forth. This disease, this virus doesn't discriminate, but we know that there was a more vulnerable part of our state that has been more heavily impacted, and that's what we're trying to alleviate now.
Of course, and one way we've seen people come together in the meantime is through vaccines. More Louisianians, of course, getting them by the day, including yourself. So what kind of timeline do you see for making more people eligible here in our state?
Yeah, well, eligibility will be expanded depending on when we have slack that starts to show up in the scheduling system. Everyone has to make an appointment for the vaccine. And by the way, I encourage everybody to mask, to distance, and to be vaccinated as soon as you are able to do that. And by accepting whichever of the three vaccines is available to you first. They're all safe, they're all effective. We're in a race against time and against the virus and the variants. And so we really need to do this. I'm not sure, but we are well over 1 million doses administered at this point. We're getting close to 700,000 people having at least one dose. We're getting close to 400,000 people having their second dose, being fully vaccinated. And starting yesterday, the Johnson & Johnson vaccine is in Louisiana being administered. That's a single dose. So every time somebody gets one of those doses, they are then fully vaccinated. And so that's going to be very helpful. We have 37,900 of those doses in the first week. Unfortunately, it looks like we're not going to get any more Johnson & Johnson for the next couple of weeks, but by the end of March, hopefully we're back on track with that, and we'll continue to get increased allocations of the Moderna and the Pfizer.
Yeah, certainly a lot of people getting that vaccine so far, or at least people who want to get the vaccine so far. So what do you think it will take, though, for the more skeptical among us to warm up to those vaccines?
Well, the good news is that most people don't say, I'm never going to be vaccinated. They say, I don't really want to do it now, which means I think they want to see other people that they know, maybe their friends, family, coworkers, whatever, get vaccinated, see how they do. And there are almost no significant reactions out there. I mean, like I said, we're well over 1 million doses administered, almost no significant reactions to speak of. We know that the vaccine is having its intended impact on blunting the virus, and we can just look to the fact that 70% of the doses administered up to now have been in individuals 60 and above. And the number of people in the hospital way down, the number of people dying, and you look at nursing homes, for example, and Harrison, that from your early reporting, about 40% of our cases were in nursing homes. Well, we've gotten just about all of our nursing homes fully vaccinated now, and very few cases there. So this is a safe vaccine. It works. And I think that the more people see that it's safe and that it's effective and that it's having the desired impact with respect to the virus. And also, I would encourage people just to understand, we can't end the pandemic until enough people have been vaccinated. And there is a common good that is served when people are vaccinated, not just a selfish motive, meaning that they won't get COVID or go to the hospital or die, but when enough people are vaccinated, then it stops spreading through the community at large. And so I would hope people look at it from that perspective as well.
Oh, certainly. And as we speak right now, Louisiana is sandwiched between two states that have removed their mask mandates and, again, loosened some of their restrictions. That's to say Texas to the left of us, Mississippi to the right. Louisiana's capacity caps, of course, loosening now under phase 3 of recovery. So how big a test is this that we're facing right now for people when it comes to taking this virus seriously and still taking this virus seriously?
Well, Harrison, that's a good question. And look, I've got more than I could say grace over in Louisiana. I don't comment on what other states do and what other governors do. I will tell you that everything I can gather from the CDC, from the White House Task Force, but also from the Office of Public Health here in Louisiana, all the epidemiologists with whom I consult on these issues, the next 30 to 45 days is going to be critically important because there are many studies that show this UK variant, which we know to be present in Louisiana and all over the state, could become the predominant strain of the virus that is circulating. And so we are in a race now to prevent the transmission of the virus while we get people vaccinated. We know masks work. We know that transmission is lowered when people wear masks. And so I am not ready to ease the mask mandate because there is no way to do that without sending the signal that it is safe for you to circulate in public without a mask on. And that happens to not be the case. And so I'm going to rely on our public health experts, even as we ease restrictions, because I do think we can do that in terms of occupancy percentages in various venues and so forth. I think that there are some things that we can safely do, but you can safely do them because you have a mask on. And so for those reasons, I don't think it's the right time. And in fact, I'm convinced it would be the wrong time to remove the mask mandate from the state of Louisiana, which is an incredibly important tool for us if we're going to effectively manage this pandemic.
Yeah, especially in the next few months, the next year ahead. And speaking of that, I want to close here with a look at that long view. So how has this pandemic changed Louisiana's future at this point?
Well, look, the way it has for everyone, it has been very challenging. It has obviously impacted our economy and livelihoods and the revenue that we have in Louisiana. That impacts our budget and so forth. But we've already recovered much of the economic damage that happened in the state of Louisiana. I am very optimistic that when hopefully by the end of the summer, no, we are much closer to normal, and virtually all of the restrictions can be lifted. That hopefully school will resume in the fall as if nothing had ever happened, and so forth. I'm optimistic that going forward we have a very, very, very bright future, and that we're going to fully recover from this. But we know that we have some long-term things to do as well. We're going to have to continue to diversify our economy. We're going to have to promote tourism and travel again. We're going to have to do all of those things as we improve our healthcare delivery system, continue to improve it, so that these health disparities do go away, and that more people have access to high quality, affordable healthcare, so that they are healthier. And not just in the event that there's another pandemic. I pray that never happens. You know, I think it's been 100 years since the last one, but because it's the right thing to do for the people of Louisiana. And I want to thank the people of our state. You know, this has been almost a year now. I think it was March 9th we had our first case. March 14th we had the first death in Louisiana. We're almost at 10,000 deaths in that time period. But the people of Louisiana have been very resilient and, on the whole, very responsible. You know, we had the highest case growth in the country at the outset of the pandemic. And for months, we were #1 in the country per capita for cases. We're number 23 now. And that's because the people of Louisiana have taken this seriously, and we've done what was required in order to make sure that the virus wasn't transmitting unnecessarily and so forth. And that's why we're doing better today. And I'm encouraging the people of Louisiana to stick with it. We've got at least another month and maybe more, because I can't really tell the future, but I know this next month or so is just going to be critically important for us and for the country, by the way.
Definitely. Governor John Bel Edwards, thank you so much for your time here.
Thank you.